Oh, yes, of course.
Okay, great.
Yeah, so PM&R was a very happy accident for me. So I knew I had several interests going into medical school, and being born and brought up in the Bay Area, I had kind of been, inculcated with the idea of like the startup culture where there's so many ideas floating around and innovation is just everywhere. So that was one thing that I just, have been so accustomed to being in the Bay Area for school. And in medical school, I also kind of had a little bit of an idea that I wanted to do something where research would be focused because that was an area where I could innovate just, beyond patient care. So I was looking for a field that had a great intersection between the ability to do research in a niche that's kind of unexplored, where I could really innovate and come out with something new, as well as the musculoskeletal system with my interest in sports medicine. And PM&R just fit the bill perfectly for that. So that's how I came across PM&R, and it's the best happy accident that I've had.
That was kind of almost like mine. I mean, I was planning after I went into the service after medical school, and my focus at that point was to go into orthopedics. The Tulane University, where I graduated from, had no PM&R program. I'd never even heard of the field. But I certainly was very interested in musculoskeletal and anatomy, and while I didn't enjoy necessarily the OR as much as I liked just patient care and diagnostics and all of that stuff, the field of orthopedics at that point was exploding because of the ability to do joint replacements and things like that. But I was in the Army in Germany, and one day as I walked out of clinic, the chief of service basically said, "Becker, what, Captain Becker, why are you seeing that guy?" And I said, "Well, I just wanted to find out how he was doing." He said, "It's a waste of your time. You're never going to get another surgery out of him."
Oh my gosh.
uh, I just kind of wanted to know whether the last one worked.
Right.
But, that's not going to get you back in the OR. And I
Yeah,
realized,
well then I guess maybe
I
maybe
realized
OR wasn't the spot for you.
that's right. I mean, if what you live for is time in the OR, and I can understand why that makes a good orthopedist, it it was for me less interesting than finding out how that intervention affected life afterwards. And I thought at that point I needed to look around and find out what else was out there. I found a book called A World to Live For, A World to Care For, Howard Rusk's book that he wrote about his early career in rehabilitation medicine. And I thought, that's very interesting. And I looked at that point, the ACGME basically published a book called the Green Book, and it talked about different medical specialties. And I looked at rehab, and it had a real deficiency in faculty numbers. It had predominantly everything I saw looked like there were opportunities in the field, and I could do pretty much whatever I wanted to do. If I wanted to be an academician, I could do that. In practice, I could do that. If I wanted to do research, I could do that. And I mean, it's been a wonderful field for me because I've done all those things and I've enjoyed each one of them along the way. So yeah, I'm so grateful for that clinic visit that basically caused me to change my whole life. So yeah, and as I've been involved with the foundation, the opportunity to review proposals has been amazing to me. I mean, I'm very fortunate that yours was one that was handed to me to review. It's the only one I've ever given out of 35 points, I gave it 35 points. It
Oh
was
wow.
an amazing piece of work, Kuntal. I was so enchanted by the research question and the methodology was immaculate, and the description of everything you wanted to do was absolutely perfect. How did you get into that area?
Yeah, so that's a great question. So essentially, I have a few people to credit for that. So first would be Mike Boninger, who is he runs the RMSTP, and I had a meeting with him during my intern year because as soon as I ended up at UPMC, I knew I was ready to get into some sort of research. So I met with him and I asked Dr. Boninger, hey, Dr. Boninger, I know you're pretty well known in the research field. Can I do some research with you? And he's like, no, you don't want to do research with me because that's not your area of interest. Why don't you meet, Dr. Fabrizia Ambrosio? She's doing something that's, kind of an area of interest for you. And why don't you chat with her and see where that takes you? So I said, okay. But if if I don't find anything I like, I'm coming back to you and I'm going to do research with you, Dr. Boninger. So he said, okay, we'll see about that. So I went and met with Dr. Fabrizia Ambrosio, who is just an absolutely lovely person. And really, I credit a lot of, the where I am today and what I've been able to do, I credit a lot of that to Dr. Ambrosio, because after meeting with her, the first thing I noticed is that we had so many similarities. Her father was a physicist. My father was a physicist. We both had, we're both very bubbly people. We just love, learning new ideas, love innovation, love talking to each other about, these different ideas. And we just clicked almost immediately. So she then invited me to the AR3T, or the Alliance of Regenerative Rehabilitation Symposium, to come get to know a little bit more about regenerative rehabilitation, which is the term that she had coined. So I went to Charlotte, Virginia, and there I basically was just so impressed by all the different research that was happening in various different areas, whether it be bioengineering, tissue engineering, cellular therapies, and of course regenerative rehabilitation. So I came back and started looking into a few of these concepts, and one that really struck out to me was heterochronic parabiosis, which is somewhat of like this morbid kind of experiment in which you suture a young animal to an old animal, which was done by Thomas Rando and others at Stanford University, and I think he's moved to a different institution since. But you suture a young animal to an old animal, and you see what happens to each animal. So the young animal gets older while the old animal gets younger, and that just absolutely fascinated me. So that's kind of where the idea came about from, because it seems like common sense. Like, yes, like, you've seen this throughout history. You've read this in literature with, Dracula, where he's trying to survive off of the blood of young females. And you see this in like blood rituals across many cultures. So I'm like, well, clearly, there's got to be something. There's something happening where, this having the blood of a young person, it has some rejuvenative effect. And that's kind of where this idea came from. And I took this to Dr. Ambrosio. I call her Fabi. She goes by Fabi. So I went to Fabi and I'm like, hey, Fabi, what if we did this with PRP? Because when I'm in clinic looking at my clinic patients, it's usually individuals who are older and have osteoarthritis and have old blood, and we're taking their old blood and putting it back in their degenerative joint. What if we took a young person's blood and put it in there? And she was like, okay, let's write it up. Let's go for it. So with her, with Dr. Sahu, who's my co-PI on the grant, or co-investigator on the grant, we wrote up the grant, and we were so fortunate enough to receive it. And that's kind of been a huge launching point for my, future career. So I really have to thank you and the foundation for that.
Well, I mean, it is such a gift for us as a foundation to be able to do things and fund things like that, even if the money is paltry compared to the size of the challenge. It still is a kickstart and helps people kind of move forward. And I mean, the questions that your project opens up are, as you know well, really profound. I mean, it is really, really capable of going miles and miles and miles in terms of big time lab money and all of that kind of stuff. And you'll be busier than you ever want to be, with more people to manage than you probably ever wanted to manage answering these questions. But what a kick to be able to do that, to have
Yeah.
that kind of a future looking ahead of you, and just dream big and keep on going. I mean, I can't begin to express how exciting that must be, and the kind of excitement that you're obviously demonstrating as you even talk about it just jumps off the page. So, I mean, my goal in this whole project with the foundation in writing letters, writing up the report to the donors, is to do exactly what I'm seeing happen here, and that is to watch a young researcher express that level of energy and optimism, and to feel, it's different than giving in church, where you get this kind of sustained long gratification but nothing immediate at all, because you don't really understand where the money that you put in the offering plate's actually going to go. But this basically is telling people exactly where it's going to go, and give people a lot of reason to give more money. So it's really exciting. Yeah.
Yes, and I'm very fortunate. Like I mentioned, like this has kind of set me up. Like, when people ask, what's your 5-year plan? What's your 10-year plan? I can tell everyone exactly what I think of my 5-year or 10-year plan is going to be, because this has set me up for such a long, exciting future. Whether it be, after sports fellowship, just kind of figuring out what we're going to do with, the extracellular side of this research, which can be used in so many different avenues, whether it be as a method to test PRP to see if it's even the right treatment for the right patient, or as a way to bioengineer molecules and reintroduce them into the PRP. It's like the possibilities are endless. And I really, like I said, I'm so fortunate and so grateful to have received this grant.
Well, and I mean, it gets into deeper questions like senescence and all kinds of things that, as we see a nation get older, with more and more people reaching into the ages that I'm in, and wanting to stay active and robust, and trying to stay afloat in every way possible. Finding research dollars for that, I think, hopefully will become progressively easier. And certainly finding philanthropic dollars ought to be becoming easier too, because there are a lot of people with a lot of money who are at a stage like, I am, in trying to figure out, okay, does it all go to my kids, or can I do something really meaningful? Yeah. Not that my kids aren't meaningful, but right now, I mean, we've got two kids, a son and a daughter, and both families are making more money than I ever made at my stage of my career. So I don't really plan on giving them a dime. They'll get some paintings.
Well, yes, it's an investment in their future.
Exactly. But I mean, it's so invigorating to do this and kind of work within the foundation. And the number of proposals has continued to increase. The sophistication of the proposals has gotten scarily tougher to review, because you're comparing. I mean, as with yours, I mean, there's a ceiling effect. Yeah, you can't get any more points than you got. So, but when you've got 3 or 4 that are at that level, we're going to have to find tougher grading criteria or things like that. Where do you look? I mean, you've got obviously presently, I mean, it sounds like great mentors in Dr. Ambrosio, and of course, you're still in contact with Mike Boninger, but and you'll wind up accumulating more people as you get deeper into this question, I'm sure.
Right. Yes, absolutely.
What do you see as the plan from here on? What are you doing with the project right now?
Right. So right now, what we are currently doing is, so we basically finished the first part of the specific aim, which had asked the question, well, what would happen if we put young blood or old blood into the osteoarthritic cells? And we looked at that across a few different ways. So first, we looked at it in vitro in the cells, where we found, okay, there was like a marked change. Like you could see the cells that were exposed to the young blood or the young PRP showed increase in type 2 collagen and SOX9 expression, which are markers of chondrogenesis. When you compared that to the cells that were exposed to the older PRP, you saw actually blunting of the effect. So then we tested this out in mice. So it was very interesting because in the mice, we saw the exact same thing. We also took it a step further and looked at the synovium as well to see if there was any effects, not just in the cartilage, which was initially what we did with our in vitro study. We just looked at chondrocytes. We also looked at the synovicytes, and we found that, yes, the synovicytes, the entire joint is actually affected. And ironically enough, or I should say, it's not actually ironic, this was just something that I feel like everyone knows, the older blood actually had a paradoxically worsened the outcomes was as compared to the young PRP. So when you compare young, saline, and old, the older PRP was causing damage. So that's where we had kind of, published a lot of this data and showed that, young PRP has undoubtedly a rejuvenative effect. This is just, there should be no doubt in anyone's mind that young PRP is much, much better than old PRP. Well, the next step is, like I had kind of alluded to, we're looking at extracellular vesicles now, because we believe that the effect is with the extracellular vesicles. And in fact, we did some depletion studies and found that when we depleted young PRP of extracellular vesicles and treated cells with that, the cells just died. They completely just died. So that's the next step, is to actually explore the extracellular vesicles and see what these tiny bundles, which are coincidentally called platelet dust, when we're looking at platelet-rich plasma, looking at platelet dust and seeing what effects this platelet dust has. So that's the next big step. And once we can kind of really delve into that, that kind of opens the door to really translational clinical research, where we can use this as something that could be, we could take down the whole FDA chain and try to get approved as treatment in the future, which again, that's part of the 10-year plan down the line. As we know, that takes a while, but that's the big dream that I'm dreaming right now.
I thought in reading the proposal, platelet dust was the thing that captured me, because I thought, what the hell is that? I don't know. I've never heard that phrase before. And then you went on and described exactly what it was. But in terms of a marketing program for research, platelet dust has a really nice ring to it. And
I
it
agree.
broke a lot of curiosity. Are the vesicles themselves genomically identifiably different? Have you?
Yes, so that's what we're doing now. So we're using image stream to kind of identify. So there's like different components of the extracellular vesicle you can kind of look into. So it could either be the contents of what's inside, it could be the markers that are outside, it could be the way that it interacts with cells. There's so many different ways to actually analyze these extracellular vesicles. So at least with image stream, one of the things we're going to look at is we'll look at the markers on the outside of the extracellular vesicles themselves to see if there's any differences with that. And then we can look at the contents, see if there's differences with that. So it's a lot of very complicated cell biology, which I would not be able to understand without a lot of my collaborators who have been so instrumental to this project.
Well, and I mean, the technology for doing that work has to be phenomenally expensive.
Yes, that is true, which is why I'm very grateful to my collaborators and Dr. Ambrosio for all her connections to be able to help out.
Yeah, I mean, needless to say, grant the size of that from the foundation would not pay a monthly rental charge.
I think then that's why just, having that first step from the foundation grant just opens up doors to, NIH grants that we might pursue in the future. So
Exactly, exactly. And certainly that's the hope that, we've seen actually the ROI on the foundation dollars has basically been about 8 to 1. $8 in large grant funding for every dollar we want spending. And for some folks, I mean, there's somebody else that Phyllis sent me a name to talk to, and I mean, his grant, basically the foundation grant, just scored him a $7.8 million multi-center study. Well, that's way more than a 1 to 8 ROI. That's unbelievably massive. And it's a fundamental research question. The research question is, which is more effective, or more cost effective and more functionally effective in rotator cuff tears, surgery, or physical therapy? Well, that's a very basic question, but it's never been looked at from the standpoint of depth of cohort, like he's got the money to do. And obviously in PCORI level research, those kinds of questions are really important, because while there may not be massive short-term dollars saved by avoiding surgery, there might be, and there certainly might be long-term gains. So I'm looking forward to having the call with that young man and his research projects. So, yeah, tell me, what else do you do for fun? What kind of things do you? Yeah, I mean,
other than my research.
Yeah, you and your husband. Yeah, right.
So we're big fans of traveling, and we absolutely love exploring new places. So we went to India just recently this past November, where we had the opportunity to explore New Delhi, sites that I haven't seen, despite having gone to India several times. We explored the city. We went to the northwest corner of India as well, Rajasthan, where my family is from, and got to see the sand dunes there, which are just a spectacular sight, and several palaces. So we are right now waiting for our next big trip after he finishes. So he's a radiology resident and about to take his big board eligibility exam, and I'm about to take my own board. So after that, we're hoping to either go to Greece or Italy. So traveling is a huge thing that we love to do. But other than that, something that we've gotten into recently as well is pickleball. I know that's big in Seattle. I know it's big in Bay Area as well. So we'll be waiting for the weather to be a little warmer so we can go out and play some pickleball.
I'm looking forward to learning. I just had a right knee replacement 6 months ago, and before that, there was no way I had the kind of lateral agility that it took without significant discomfort. And I'm now far enough along so that our across the street neighbors are very avid pickleballers, and they keep saying, we'll have to take you out. And I'm now ready to go out, although we're still now here in ski season, and I'm basically gonna try my knee. I've been throughout my career the high level skier. I've skied with Olympians and ski patrolled and taught. And so I'm a competent skier, but I got to the point with my knee that I really was not safe, not feeling comfortable that I could really do what I needed to do. So this weekend we're going to Idaho, and we'll spend a week there skiing.
Oh, fantastic.
Or sit with myself feeling sorry in the lodge because not quite strong enough yet. I mean, it's amazed me in coming back from the joint replacement on my knee, how much post-operative atrophy occurred, despite the fact that I tried to keep it going. So,
right, yeah, Well, I'm hoping the trip to Idaho is great for you. So my husband's from actually the eastern corner of Washington State, like very close to Idaho and Canada.
Where?
So we just went there for Christmas. He's from Colville, Washington. It's
Oh,
near.
sure, I know Colville well.
Yeah, yep. So he's from Colville. So it was my first time there, which was a great experience for me to see, like what a town of 2,000 people looks like versus the city of 10 million where I'm from.
Right. I mean, we moved to Bend from Spokane, so
Oh, okay.
that region is very, very, very familiar. We've been in Spokane for 19 years, and I ran a rehab hospital there, and then later started a research laboratory at Washington State University in Pullman.
Oh,
So the
wow.
whole Colville area is very familiar to us. Yeah, I mean, I love Eastern Washington. I mean, the geography of Eastern Washington, the whole Pullman area and Palouse area is marvelous. The geology, the understanding the effect of Lake Missoula and the Lake Missoula floods, which are geologically quite recent. And realizing that that whole area prior to those floods probably was riddled with people and animals and all kinds of things like that. And nobody can withstand a wave that's 600 feet high, which was really interesting. Well, fascinating. Well, I won't keep you any longer. This has been incredibly valuable from my standpoint, Kuntal, and I can't help but wish you the very best, but know that given your energy and enthusiasm, the very best is likely to happen.
Oh, thank you so much. Thank you so much for the kind words. And again, I can't thank you enough for this wonderful opportunity to, receive this grant and really have a launching point for my career from this wonderful, blessing that I've received.
Well, I mean, the beauty of your curiosity obviously put things in your pathway that you were smart enough to pick up on immediately, and your congeniality probably is going to bring more people to you than it ever drives away. So, it's a blessing to be as gifted as you are, both intellectually and societally, from a social intelligence standpoint. I mean, people are and networks are what you're going to move your field forward. And I just wish you the very, very best of all. So thank you so much for your time.
Thank you. And hopefully, if we're ever in the Seattle area, I would love to actually meet with you in person.
Well, we're in Bend, Oregon now. So
Oh,
we're
okay.
in Central Oregon, which is to get from Spokane to Bend is a 7-hour drive. So it's a ways. We're really kind of, if you were to take Oregon as a big square, we're kind of about close to the middle, up and down, and a little bit more toward the western side on a longitudinal framework, but or latitudinal framework. But the difference between Spokane and Eugene, or Spokane and Bend, is that Bend basically gets about 364 days of sunshine a year, whereas Spokane did not.
I did discover that.
And our grandkids are closer here, so it's much, much easier to be a grandpa. Yeah.
Got it. Well, wonderful.
Yeah. So thank you again for everything. And I really appreciate your time and your energy. And I look forward to hearing so much more about your work.
Thank you. Thank you. Hope you have a good rest of your night.
Thank you, Kuntal. You take care. And thank your husband for sharing your time.
Thank you.
Okay. Bye-bye.
Bye-bye.